This Healthy Living tip is brought to you by the Christ Hospital Health Network.
There are many common gynecologic problems which during routine gynecologic care can be discussed with your provider. It provides an opportunity to discover which problems may be impacting lifestyle and for which problems there may be an appropriate therapy that can get you back to doing the things that you enjoy that you may have been avoiding because of the problem that you are having. The most common gynecologic problems that women have revolve around pelvic pain, heavy bleeding, and complications from pelvic floor weakness. Minimally invasive surgical approaches have really been a revolutionary part of our specialty over the past several years. Minimally invasive techniques allow patients to return to the activities that they enjoy doing much more quickly. We also have the benefit of having fewer complications with minimally invasive surgical approaches. There is less risk of infection, less risk of morbidity, and a faster return to work that people have after having a minimally invasive surgical approach. In this country, about 30% of procedures, gynecologic procedures, are done minimally invasively. At the Christ Hospital, we're the opposite of that. We have 70% of our procedures are done in a minimally invasive fashion. 30% are done the traditional open surgical procedure that's been around for a number of years. That's really becomes a change for women that they can get back to their activities that much more quickly. Some of the more common gynecologic conditions that are well suited to minimally invasive therapies include uterine fibroids, heavy bleeding, endometriosis, for example. Those conditions are well suited for a minimally invasive surgical approach. As a patient, if you are considering a surgical procedure, it's best to have a conversation with your physician as far as determining the best surgical approach. At the Christ Hospital, we have a group of physicians and a surgical team that has embraced minimally invasive surgical technology as a way to provide the best outcomes for women. At the Christ Hospital Women's Surgery Center, we have all the disciplines providing gynecologic care in one location. We utilize robotic technology, minimally invasive techniques, and pelvic floor surgical procedures. Routine gynecologic care is an important part of every woman's life. Conditions that impact lifestyle, such as heavy bleeding, pelvic pain, pelvic support problems, are things that should be discussed with each individual's physician. If a non-invasive medical therapy is not successful and surgery is an option to consider, minimally invasive technologies are something that should be discussed with your physician. At the Christ Hospital, we have the advantage of having a dedicated surgical team and a medical staff that has embraced pursuing minimally invasive surgical techniques because of the advantages that they provide all of the patients.
The Christ Hospital is the area leader in minimally invasive women's surgery. To learn more or to find a specialist, call 585-1000.